Plantar fasciitis is one of the most common conditions we see at our practice. But how would you know that the pain you're experiencing is actually due to this condition? Hi, I'm Dara Nichiforova at Podiatry Associates. Today our doctor, Jeffrey Niemöller, is here to tell us all you need to know about this painful condition and how to effectively treat it. Hello, doctor. Please tell us, what exactly is plantar fasciitis?
Plantar fasciitis is one of the most common conditions we see in the foot. And basically what it is inflammation of a structure that's on the bottom of the foot that runs from the heel bone to your toes. And as it becomes inflamed, you develop a great deal of foot pain.
What is the most common symptom?
Most common symptom is pain first thing in the morning or after you get off of your feet. When you step on your foot for the first time, you get a deep, really intense burning pain on the bottom of your foot. It's also common with this condition to experience numbness on the side of the foot due to inflammation of a nerve that runs on the side of the foot. And eventually, as the disease progresses, though, the pain will go from just being from first thing in the morning or when you first get on your foot to being there all the time.
On a scale of 1 to 10, how severe is the pain?
I would say it's probably about an 11.
Oh, wow.
I've had people come into my practice and they relate the pain to being stuck in their foot with a knife or stepping on a nail, stepping on a sharp tack. And it becomes to the point where the pain almost becomes unbearable or unlivable. And I've had people come in with this condition and when I tell them what it's all about, they tell me that can't be what it is. I have to have something more serious because the pain is so intense.
I see. So what is the plan of action?
The plan of action is you always want to first start with conservative care. The first thing you want to do is get an x-ray done. You want to confirm that they actually are experiencing plantar fasciitis and not, God forbid, a more severe condition, say like a calcaneal stress fracture or a true fracture of the calcaneus, which is the heel bone of the foot. Once you rule out that there's no other conditions present and you are dealing definitely with plantar fasciitis, you want to first start with a conservative course of action. And the first initial treatments are geared at reducing the inflammation in the plantar fascial ligament. You can first begin with a series of cortisone or steroid injections. You can tape the foot to support the arch to again relax the inflammation in the plantar fascial ligament. You can also prescribe what are called custom-made orthotics to help stabilize the arch. If a period of pain is going on, say 1 month or 2 months, then the next step is to do what's called an Mri exam. And basically what you want to check for is to make sure that there's not, first of all, something that the x-ray may have missed, say like a soft tissue mass or a tear in the plantar fascial ligament. If one of those conditions is found, then you definitely want to move on to the next course of treatment, which would be more of a surgical treatment approach, particularly if you're using conservative treatment options, say like a month or 2 months, and there's no improvement in the pain.
Thank you, Dr. Niemöller, for this great information. There is no doubt that plantar fasciitis is painful. If you think you may be suffering from this condition, please visit us at